we're going to show you how to do an Indian head massage. Demonstrating this technique will be James Orsi, a nationally certified massage therapist from the United States. Step 1. What you will need: a chair, a volunteer. Step 2. Setting up. Find a quiet place if possible, away from any distractions. You can even play some soft music or light some candles to help create an atmosphere of relaxation. It is also very important that you let your volunteer know that they should tell you immediately if anything is painful or the pressure is too strong. Have your volunteer take a seat and make themselves comfortable. Stand behind them and place your hands lightly on their shoulders as you both take several deep breaths. Step 3. Shoulder massage. Gently begin squeezing the trapezius muscle, starting close to the neck and working your way outward to the shoulder. Return to the neck and repeat 3 times, allowing the pressure to increase each pass. Bring the hands back up next to the neck with the thumbs extended, and begin making small circles with the thumbs on either side of the backbone, just below the collar line. Continue with the circles up the back of the neck until you reach the hairline. Lower the hands back down and repeat 2 more times. Now place the forearms at the sides of the neck and roll them outwards towards the shoulder by rotating at the wrists. Lift the forearms and move them a couple of inches away from the neck and repeat. When you reach the shoulder, come back to center and repeat 2 more times. Step 4. Neck massage. Step to one side of your volunteer and place your back hand at the base of their neck and your front hand on their forehead. This is done with very light pressure and is only used to keep the head from falling forward. With the back hand, spread the thumb and fingers and begin to glide up the back of the neck, avoiding putting pressure directly on the vertebrae. Once you reach the hairline, remain there for a moment with light pressure on the back of the head. Lower the back hand and repeat this about 5 times. You can even add some circling to the upward stroke if there seems to be a lot of tension present. When the back hand reaches the hairline for the last time, let it remain there. Slowly allow the head to tilt forward without strain or effort. Then, gently lift the head back to vertical and continue backwards, again without forcing, simply allowing the head to move within its own range of motion. Repeat this 3 times, front and back. Step 5. Scalp massage. Step back behind your volunteer, loosening the hair if it has been put up, and bring your hands with fingers spread to the sides of the head, fingers pointing up. Use a light pressure and slowly move the hands up with a shampooing-like motion, trying to keep the heel of the hands in contact with the scalp as well as the fingers. Once you reach the top of the head, allow the fingers to rise off while maintaining a gentle traction from the heels of the hand. Now, lower the hands down and move the hands around to a different area of the head. Repeat 4 or 5 times, covering the entire scalp. Bring one hand to the forehead for stability as you place the heel of the other hand in contact with the back of the head. Begin rubbing the scalp by moving the back hand vigorously back and forth. Carry on rubbing as much of the scalp as you can reach, then switch hands and repeat on the other side. Now briskly rub the scalp all over with just the fingertips of both hands. Continue this for about a minute. Step 6. Forehead massage. Allow the rubbing to slowly change to stroking the fingers through the hair from the top of the forehead back. Step closer and let the final strokes draw their head back slightly, and then lay the fingers over the forehead. From the center, draw the fingers down and along the brow line to each temple. With the index and middle fingers extended, make small circles over the temples. Then, bring the hands back to the forehead and repeat 3 times. Step 7. Finishing strokes. Finish with smooth strokes beginning at the forehead and slowly working your way to the back of the head. Carry on for about a minute, allowing the pressure to become lighter towards the end until finally your hands float off the head. We begin with a light contact to the middle of the back. Remain here for a moment and try to connect with the person's breathing. Step 5. Upper trapezius squeeze. Without breaking contact, move the hands to the upper shoulder next to the neck and start to gently squeeze the trapezius, which is the triangular shaped muscle on each side of the neck, following it down to the tops of the shoulders. Repeat this 3 times, gradually increasing pressure but avoiding any discomfort or distress. Step 6. Finger circling. Straighten the hands and place one on top of the other with the fingers in line. Now, place the fingers of the bottom hand at the top of the neck. Keep the arms extended and move with your entire body to make small circles with your fingers. Using firm pressure, continue down the neck, then along the top of the trapezius to the shoulder. Repeat 3 times. Step 7. Side change. To change sides, we remain with hands in contact as we step the forward foot back and take 2 small steps to the other side. Then, step the other foot forward into our behind position. Repeat finger circling 3 times on this side. Step 8. Neck rub. Come to the side by stepping the back foot forward and face towards the person. We make lobster claws with the hands, that is, separating the thumbs from the rest of the fingers. Alternating hands, we will gently rub, then lift the muscles on the back of the neck. With practice, this becomes a fluid windshield wiper type motion and is very relaxing for the person receiving. Repeat this approximately 20 times. Step 9. Scalp massage. Move in front of your partner and place the fingers at the hairline on the back of the head. Starting from the center, make tiny circles with the fingers moving outward. Continue up the back of the head, massaging the scalp as if you were shampooing the hair. Once you reach the top, move back down the sides of the head. Once again, move to the side of your partner and repeat the neck rub about 10 times. Step back to the behind position, form the hands into loose fists, and begin gently tapping on the back and shoulders with the little finger side of the fist. Cover the entire upper back and shoulders. Open the hands with fingers together and proceed to do karate chops along the trapezius and upper back. Remember, we are only trying to stimulate, so easy with the pressure. Step 10. Finishing strokes. We will finish with light downward strokes from the shoulders to the low back. The final strokes slide off, finally breaking contact. The most important thing to remember is that the person being massaged should be as comfortable as possible to enhance the relaxation and deepen the benefits of the work. To begin, undrape the part of the body we are going to massage. Put some oil in a cupped hand and warm it by rubbing the hands together. Step 3. Stroking. Apply the oil using long, smooth strokes. This is one of the most basic techniques, but also the most used. It is an opportunity to find out where there are any tension spots or sensitive areas, and it also serves as a smooth transition between the other techniques. You can vary the tempo and the pressure to explore the range of sensations, but it is generally recommended to use the greater pressure towards the center of the body. Step 4. Lifting. Now that you've applied the oil, you'll begin lifting the muscle to free up any stuck fibers. With the hands parallel, grasp and lift the muscles with the little finger side of the hands. Try to keep in contact with the person at all times, even at the top of the lift. Move the hands in towards the person's center and repeat. When you reach the draping, stroke back down and start again. Repeat 2 or 3 times, covering the entire body part. You can also lift with the individual hands, which is useful on the smaller parts of the body. Step 5. Friction. Let one hand reach around while the other stays on the side closest to you. With a fluid motion, bring the far hand close while reaching around with the other. Friction is very close to stroking, but usually a bit deeper, moving the fibers of the muscle. Move towards the center, then back down again. When you find a tight muscle or knot, you can be more specific, often using thumb strokes to apply friction to the tense area. Step 6. Pressure points. If friction doesn't reduce a knot, slow direct pressure can help ease the tightness. Apply a gradually increasing pressure to the point, holding it for up to 8 seconds, and then release. It is very important to communicate with the person to make sure you are using the appropriate amount of pressure. Usually, the thumb is the best way to apply specific pressure, but other fingers can be used, or even a knuckle or an elbow. Never apply strong pressure to joints, major blood vessels, or the spine itself. Step 7. Percussion. Make loose fists with both hands and gently start tapping the muscles using the little finger side of the fists. You can change the tempo and pressure depending on the body part, as well as opening the hand and using a karate chop. By this time, the muscles are starting to loosen up, increasing the blood flow and allowing the nervous system to perform the body's self-maintenance. Finish the body part with more stroking, gradually letting the hands break contact. Redrape and move to the next area. By using these 5 techniques on the arms, legs, stomach, back, and head, you can give a complete full body massage. The ideal location is somewhere the person can lie down comfortably, like a massage table, bed, or sofa, and their feet can extend slightly over the edge. The pillow is placed underneath the knees to help support the low back, while we use the towel underneath the feet to catch any excess oil. Position yourself at their feet with the toes at about chest level. Step 3. Getting started. Do a visual check of the feet for any open cuts, bandages, or possible athlete's foot, as these are all reasons not to do the massage. Apply some alcohol to the cotton and wipe down both feet thoroughly. Place a small quantity of oil in a cupped hand and warm it by rubbing it between both hands. Spread the oil over the foot up to the ankle by using light, even strokes. Step 4. Warm up. Taking the foot in both hands, we begin doing twists by pulling toward ourselves with the heel of one hand while gently pushing away with the other. Start at the top of the foot near the toes and work your way down to the heel, then back up again. Repeat 3 times. Now place the outside hand on the top side of the foot for support, and extend the second knuckle of the index finger on the other hand. Sandwich the foot between the 2 hands while rotating the knuckle by turning the wrist. Move the knuckle down and repeat. Carry on over the entire sole of the foot. Step 5. Thumb work. Place the fingers of both hands on the top side of the foot, and starting at the pads of the toes, begin making downward strokes with the thumbs. After finishing the toes, move down to the ball of the foot, then the arch, and finally the bottom of the heel. Now return to the arch and make circles with the thumbs with moderate pressure. Once more with the outside hand supporting the top side of the foot, we now take the thumb of the other hand and begin doing pressure points down the instep, starting at the knuckle of the big toe. Release the pressure, move down slightly, and repeat. Carry on until you reach the back of the heel. Now, the outside hand moves to support the foot from underneath the ankle. With the other hand, we will grasp the Achilles tendon between thumb and index finger and stroke towards the heel. Repeat this 5 times. Step 6. Top and sides. Both hands now open and support the foot from below. With the fingers extended, we begin to make circles around the ankles, again using a moderate pressure. Without breaking the rhythm of our circling, the fingers start to move around to the sides of the foot and continue up to the toes. At this point, the circling becomes a back and forth movement as we massage the top of the foot, focusing between the tendons. Carry on for about a minute. Step 7. Toe massage. Finishing at the base of the toes, we will now begin to slowly tug, twist, and pull on each toe, alternating as we move inwards from the outer toes. Step 8. Finishing strokes. We end by repeating the foot twists, but this time, we slowly begin to lighten pressure with each twist until the hands lightly lift off the foot. Step 9. Repeat on other foot. Once again, place some oil in your cupped hand and repeat the steps on the other foot. Go to the person's side and spread the oil evenly from the mid-back to the top of the hips with smooth gliding strokes. Step 4. Palm circling. Place one of your hands over the other with both arms extended. With a motion that starts from your waist, begin making circles with the palms. Allow the circling to move towards the head without crossing over the backbone. Once you reach the low ribs, bring the palms around towards the sides and continue circling down towards the hips. Since there are no ribs protecting the low back, we should always use an easier pressure to avoid discomfort or injury. Step 5. Muscle lifting. Without breaking contact, form the hands into lobster claws by keeping the fingers straight and spread the thumbs. Now begin gently lifting the muscles of the low back by making a turning motion with the wrist. Continue alternating hands, developing a smooth windshield wiper-like rhythm, covering the side of the back nearest to you. This is a good time to check with the person to see if you are using a good level of pressure. Step 6. Thumb work. Finish the muscle lifting around the low ribs and turn towards the person's feet. Now with the thumb extended, begin applying slow strokes down the muscles along the side of the backbone. When you reach where the spine connects to the hips, allow the thumb to slide off as the other begins again from the low rib area. Carry on with the thumb strokes as you move away from the backbone towards the sides. Start again from next to the backbone and repeat the cycle 2 more times. Now begin muscle lifting along the top of the hip bone. As you get to the center, lay your outside hand on the sacrum and move around the head to repeat the palm circling, muscle lifting, and thumb work on the other side. Step 7. Knuckling. Once again, come to the sacrum, but this time slowly tuck the fingers in, making fists with both hands. And with arms extended, drag the knuckles up along the side of the spine to the low ribs. From there, roll the fists over so that the larger knuckles are in contact, and with a light pressure originating from your center, slowly start moving down towards the sacrum. Then, use the knuckles of the index fingers to make circles out along the tops of the hip bones. When you reach the sides, bring the knuckles back to the sacrum and repeat the cycle 3 more times. Step 8. Back spreads. On the final cycle, when you reach the sacrum, open the hands and maintain a steady pressure on the top of the hips towards the feet. Allow the hands to slowly slide out to the sides while maintaining the pressure. Now, turn towards the person again and place the hand that is nearest to the head on the top of the sacrum, with fingers pointing towards the feet, Place the other hand just above with fingers pointing towards their head. Keep your own back straight and begin to slowly spread the hands apart. It is important that you don't put any pressure on the spine itself. When the upper hand reaches the mid-back, move to one side of the backbone and repeat. Then once more on the other side. Step 9. Finishing strokes. Extend one hand across the low back, with the other hand close to you. Now with a fluid motion, pull the far hand towards you as you push the near hand away. Continue alternating pushing and pulling as you cover the entire low back and sacrum area. Allow the pressure to lighten as the hands slowly lift off. And then begin spreading it across the person's back with light flowing strokes. Be sure to cover the shoulders and neck area as well. Step 3. Palm circles. Now place one hand flat on the low back and cover it with the other hand. With arms extended, begin making small circles. Continue up the back, then down again. Repeat 2 to 3 times, allowing the movement to come from the waist rather than from the shoulders. Step 4. Muscle lifting. Lift the top hand off and make it into a lobster claw, closing the fingers and opening the thumb. Use a lifting motion on the muscles by twisting at the wrist. Keep alternating hands to create a windshield wiper type motion. Move up the near side of the back, then down again. Repeat 2 to 3 times. With practice, this becomes a smooth, confident rhythm. Step 5. Knuckling. Form the hands into loose fists with the knuckles and fingers in contact with the back. With arms straight and the movement from your center, slide up the near side of the back. Remember not to put pressure on the low back and avoid the spine. Continue up over the shoulders, then lightly drag the knuckles back down. Repeat 2 to 3 times. On the last knuckling, instead of dragging down, use muscle lifting on the trapezius, which is the muscle that connects the neck to the shoulders. This is often one of the more tense spots on a person. Continue rubbing as you move around the head, and repeat palm circling, lifting, and knuckling on the other side. Step 6. Thumb strokes. Come around to above the person's head. Use an extended thumb to start making upward strokes between the shoulder blade and backbone. As one thumb slides off, the other begins its stroke, creating a constant rhythm. Gradually move over and continue on the other side. Now bring both thumbs to the upper back on either side of the spine, and with constant pressure, slowly begin to slide all the way down the back. Remember to be careful over the low back where there are no ribs for protection. When you reach the top of the hips, allow the thumbs to remain there a moment with a steady pressure. Slide the hands back up and repeat 2 more times. Each time moving a bit farther to the sides. Step 7. Twists. Come back around to the person's side. Let one hand reach around to the far hip. With a fluid motion, pull the far hand towards you as the near hand pushes away. Now repeat the movement as you work your way up the back to the shoulder area. Then back down again. Repeat this cycle 3 times. Step 8. Finishing strokes. Turn your body towards the person's head and spread the fingers of both hands. Draw the fingertips of one hand down the back. The fingers lift off at the top of the hips as the other hand begins again from the shoulders. Repeat several times as you cover the entire back and being careful not to scratch with your fingernails. Slowly allow the pressure to lighten until the hands float off the back. Turn facing the body, and the final contact will be one hand at the base of the skull and the other on the sacrum. Remain here about a minute, and then slowly lift the hands away. Take both hands in yours and make sure there are no open cuts or bandages, as they may be affected by the use of oil. Take a few deep breaths and focus on how the hands feel, noting whether there is tension or gripping. These areas will need more attention. Step 3. Apply the oil. Place the person's hands down and put a small quantity of massage oil in your cupped hand. Rub it between both hands to warm it up before applying. Lift their right arm, and whilst alternating your hands, spread the oil up the forearm and over the hand, being sure to get the fingers as well. Step 4. Arm spreads. Hold their arm close to the elbow with their palm up, and your fingers beneath and thumbs on top. Now begin to spread the muscles by gently squeezing their arm between fingers and thumb and pulling toward each side. Carry on until you reach the wrist, then begin again from the elbow. Repeat this 3 times. Step 5. Thumb striping. Now take your volunteer's hand in your right hand and place your left hand at their wrist with your thumb straight. Run the thumb in a stripe up to the elbow. Then rotate the hand around and draw the thumb back down the arm. Now place your right hand at their wrist and run a stripe up the back of the forearm. Swap hands again and repeat. Carry on for about a minute. With practice, this can become a smooth, rhythmic technique that is guaranteed to bring relief to tired arms. Step 6. Thumb circles. Bring both little fingers around over the top of the hand and catch the thumb and little finger. Gently spread the hand open and make circles on the wrist with the thumbs. This maneuver may take a bit of practice at first, but when done with a fluid motion, it creates a seamless transition to the handwork. Carry on for about a minute. Now begin to make circles over the entire palm, focusing on the base of the thumb and fingers, and any other areas that seem tense. This is especially good for anyone who works with computers or suffers from carpal tunnel syndrome. Without breaking the rhythm of your circling, release the little fingers and slowly roll the hand over palm down, and do circles over the back of the hand, again focusing on the wrist and knuckles where the fingers connect. Step 7. Finger massage. Supporting their hand in your left, begin massaging the base of the thumb between your thumb and forefingers. Slowly work your way up to the fingertip, gently squeezing the sides of the nail before giving a quick tug. Now change hands and repeat along the little finger. Continue alternating hands until you've massaged every finger. Step 8. Wrist rotation. Take your partner's hand in your right hand with the thumbs interlaced and fingers wrapped around. Supporting their forearm with your left hand, slowly begin to rotate the hand around the wrist. Begin with small rotations, then slowly increase the range of motion as long as there is no resistance or discomfort for your partner. Repeat in the other direction. Step 9. Finishing strokes. Release the hand grip and once again apply long, smooth strokes from wrist to elbow with alternating hands, as we did when applying the oil. Carry on for about a minute, allowing the pressure to become lighter towards the end until finally your hands float off as you lay the arm down. Now, place a little more oil in your cupped hand and repeat these steps on the other arm. With smooth gliding strokes, spread the oil evenly over the upper back, neck, and shoulders. Step 4. Muscle lifting. Without breaking contact, form the hands into lobster claws by keeping the fingers straight and spreading the thumbs. Now begin gently lifting the muscles of the upper back by making a turning motion with the wrist. Continue alternating hands, developing a smooth windshield wiper-like rhythm, covering the side of the back nearest you. This is a good time to check in with the person to see if you are using a good level of pressure. Now turn your body towards the person and proceed to the neck. After about a minute, move around the head without breaking contact and repeat on the other side, starting on the back. Once you finish the neck on the second side, move around above the head and rub both sides of the trapezius at the same time. Step 5. Knuckling. Again without breaking contact, slowly tuck the fingers in, making fists with both hands. Starting from the outer shoulder, pull the knuckles in along the tops of the trapezius muscle. As you reach the sides of the neck, roll the wrists under, bringing the larger knuckles into contact as the knuckles of the fingers continue up the back of the neck to the base of the skull. Hold for a moment, then reverse the movement down to the base of the neck. Continue knuckling down the back between the spinal column and the shoulder blades. When you reach mid-back, draw the knuckles back up to the neck, once again rolling the wrists under and pressing a moment at the base of the skull. Repeat this cycle 3 to 5 times. Step 6. Thumb striping. With the extended thumb, begin drawing up from the mid-back to the trapezius. Just as the first thumb is about to slide off the top of the shoulder, begin sliding the other thumb up the same side. Continue alternating thumbs for about a minute. Now, without breaking the rhythm, change the direction of your striping down along the side of the neck towards the top of the shoulder. After another minute, move down to the low shoulder and work there for about a minute. Now, stroke back up to the neck, then repeat the cycle on the other side. Step 7. Shoulder rotations. This time, after finishing the lower shoulder, move around to that side and allow your outside hand to slide around to the top of the shoulder and support from beneath. Now extend the fingers of the other hand and place them along the inner edge of the shoulder blade and begin rotating the shoulder so that it rolls over the extended fingers. If there's a lot of tension here, you can also extend a thumb and apply deeper pressure. After the final rotation, keep a pressure on the shoulder towards the person's feet, as the thumb of the other hand slides up to hold at the base of the skull. After a few moments, do muscle lifts on the shoulder area, then move around the head and repeat the rotations on the other side. Step 8. Finishing strokes. After the rotations, remain on the side and turn towards the person. Extend one hand across the upper back and the other hand close to you. Now with a fluid motion, pull the far hand towards you as you push the near hand away. Continue alternating pushing and pulling as you cover the entire upper back and shoulder area. Allow the pressure to lighten as the hands slowly lift off the back. Take a few deep breaths, and if you wear glasses, remove them before starting. Step 2. Head tapping. Let's begin by gently tapping the head by drumming your fingertips all around the top of the scalp. This stimulates blood flow and brain cell activity. Carry on doing this for about a minute. Step 3. Forehead swipes. Next, flatten both hands with your palms facing you and hold them at forehead level. Now, turning your head from left to right, alternate swiping the forehead with the fingers of the left and right hand. It should be your head that is moving and not your hands. Repeat this about 10 times to each side. Step 4. Circling the eyes. With the hands at eye level, now make loose fists while placing the thumbs on the cheekbones. Starting at the bridge of the nose, firmly draw the knuckles of the index fingers in an arc across the eyebrows and down the outside of the eye. Then once again starting from the bridge of the nose, this time draw the knuckles in an arc beneath the eyes on the crest of the cheekbones. Repeat this cycle approximately 10 times. Step 5. Palming the cheeks. Once again open the hands and place the palms over the cheekbones. Firmly draw the palms down towards the mouth. Then, continuing along the bottom edge of the jawbone. Follow the line of the jaw upwards to just in front of the ears, then in along the cheekbones, completing a cycle. Repeat this cycle 10 times. Step 6. Mouth swipes. Now we turn the hands with fingertips pointing towards each other and the palms towards you as in the forehead swipes, but this time at mouth level. Again, you are moving the head side to side, swiping the mouth and lips with your fingertips. Remember, it is the head that turns while the hands remain stationary. Repeat 10 times to each side. Step 7. Throat pull. Lowering the hands to neck level, using very light pressure, place one hand on the throat and pull directly forward while closing the thumb and forefinger so that you tug gently at the skin. As the first hand is sliding off, the other hand is rising to repeat the process. With practice, you can achieve a steady rhythm. This should not be painful or uncomfortable. Repeat with both hands 10 times. Step 8. Ear massage. To begin, we are going to make Spock hands. That is, with your little finger and ring finger together, and middle and index finger together. Place the hands on the side of the head with the ears between the fingers, and massage up and down. Repeat this 10 times. Now we will massage the ears. Starting at the tops, rub the ear firmly between the thumb and the first 2 fingers. Continue down to the lobe, covering the entire ear. To finish, Give the earlobe a firm tug, then the middle of the ear, and finally the top. Repeat this 3 times. With the person lying down, we will apply all these techniques to the arms, the back, and both sides of the legs. Step 3. Rocking. Start at the point furthest from the heart and begin alternating pushing and pulling, creating a rhythmic rocking motion. Continue this movement as you begin to move towards the center of the body. When you've gone as far as possible, go back down as you carry on rocking. Repeat this cycle 3 to 5 times, covering the entire body part. Step 4. Lifting. Next, form lobster claws with the hands, bringing the fingers together as you extend the thumbs. And with one hand, grasp the muscle and lift off as you close the thumb and fingers together. With practice, this becomes a seamless rhythmic movement that you continue while once again moving in towards the center of the body, then back down again. Repeat this cycle 3 to 5 times. Step 5. Pressing. Place one hand over the other and with arms extended, begin pressing the muscles, allowing the movement to originate from your waist. Hold for about a second, then release. Move towards the body center and repeat. Continue up, then back down, repeating the cycle 3 to 5 times. Always avoid putting pressure directly on the joints. Step 6. Rotations. Now go to the far articulation, either the ankle or the wrist, and support the limb as you rotate the joint 5 times clockwise, then 5 times counterclockwise. It is important to note here that you never force the movement beyond the natural range of motion. For the arm, we'll flex and open the elbow 5 times. The knee we will flex while working on the back of the leg. Finally, rotate the hip or shoulder by facing the head and reaching under the joint with the outside hand while supporting the limb in the other. The movement is coming from the waist as we repeat the rotations 5 times in each direction. Step 7. Percussion. We finish by making loose fists and rhythmically tapping on the body with the little finger side of the hand. Cover the entire body part, then open the hands and do karate chops with light pressure over the area. Finally, cup the hands and tap with the palms. Now move on to the next body part and repeat the steps. A good order to follow is by starting with the front of the legs, then move up to the arms. Have the person flip over, and continue with the back of the legs, and finally the back itself.